provides relief for middle-income individuals, a more competitive model for businesses, and a simplification for everyone.
Sarah Huckabee Sanders, presidential press secretary, in one of the less contentious portions of yesterday's press briefing. But even though her description of health care may have lacked any type of contention, that is not the case on Capitol Hill, where health care was so contentious that the Republicans had a, well, I guess we could euphemistically call it a setback there on the Senate floor with that dramatic vote last week. But was it a setback, or is there an opportunity for true conservative health care to rise phoenix-like from the ashes of last week's vote? Joining us now via Skype from the Tampa St. Pete area of Florida is our good friend who happens to be an expert in healthcare law and healthcare policy, Washington Examiner contributor and the CEO of Rotella Legal Group. It's our friend Brian Rotella. So Brian, is there anything that can rescue healthcare and that can still have some semblance of a conservative market-driven plan?
Good morning, my friend JD. It's great to hear from you again. You know me, I love pop culture and movies, and I'm going to date myself, but I know you remember this one. It feels an awful lot like the War of the Roses, doesn't it, between the leadership in the GOP and our president, and then you throw in Senator Schumer and Congresswoman Pelosi. All I can think of is Danny DeVito's character saying, "There's no winning, there's just degrees of losing." And comedy aside from that, the losing is for the American people right now. I would love to tell you, JD, that I think, as you very artfully said, that there will be a conservative and free market model, innovative healthcare model that will rise like a phoenix from the ashes. I hate to tell you, I don't think it's going to happen in this dysfunctional culture that we're living in Congress right now. What I mean by that is the Republican Party has to start selling what is good about its ideas with healthcare. And what I mean by what's good is ideas that people can relate to. When we think about two industries that changed dramatically in the last 30 years, one of them is music. Remember, you and I go back to cassettes and 8-tracks and albums. A lot of folks right now wouldn't even know what those are. But you basically, if you bought an album of the Rolling Stones, you had to like every song on it, or hope to. You didn't have the ability to pick out which songs you like the way you can on iTunes, or even better yet, the way you now can match your music taste to a subscription like Spotify. That's something that people across the United States, especially younger people, really like. There are healthcare innovative models like Spotify. There's direct medicine, there's concierge medicine. And what's really disappointing, there were dollars in that GOP bill dedicated, billions of dollars, to finding those innovative models. I don't know about you, JD. I didn't hear the Republican Party selling any of that. If they don't start selling what their ideas are, it's really easy for the Democrats just to say, look, tons of people aren't going to be covered, and to go to the hyperbole of dying in the streets.
Well, I will tell you, Brian, that cultural references abound. I especially appreciated your somewhat dated reference to War of the Roses, and keeping that in mind, take a look at the headline from the Washington Post, and it uses what used to be a franchise in the Ladies' Home Journal back in the day. Can this marriage be saved? Relationship between Trump, Senate GOP hits new skids. But Brian, this is symptomatic of what's going on in the entire party. It seems the establishment Republicans are resistant to Mr. Trump and many of his ideas. And you were mentioning the failure to mention during the debate or to trumpet some of the innovations. I can tell you what happens. I've heard it from pollsters. I've actually had pollsters and consultants tell me, when you mention the free market and when you mention the word wealth, it upsets voters. Now, maybe we're to that point in our society, and maybe there's a more voter-friendly way to say, give you more control of your medicine and health care, but to the practical problem at hand. Will congressional Republicans, will Senate Republicans understand they're tied to this president? If they fail to move forward with some implementation, then their majorities are doomed. Or do you think, knowing Washington as you do, that some of these establishment Republicans would rather lose the majority and see Trump lose the White House in 2020 rather than give up some of their power or their prominence in the way things work now?
I'm going to stay with my War of the Roses theme. There's another great scene in that movie where Kathleen Turner tells Michael Douglas that the biggest mistake of his life is moving back in the house with her after they do their divorce. And Michael Douglas, Riley says, no, it was the second worst mistake, obviously alluding to their marriage. I think right now you have folks in the GOP that never felt comfortable being married to Donald Trump. And now they feel like they've moved into a house with somebody that they really didn't want to be married to in the first place. And that's what the public is seeing, JD, is you're seeing a marriage, keeping that same theme, that really never got off to a good start. We remember last year, we were still heavily in the debate of never Trumpers. So how do you take this fragmented group of folks post November 9th of last year, where the president had this tremendous historic victory, and get them to suddenly rally behind him? And that's where I go back to what I was just mentioning on the healthcare issue. You're absolutely right. You can't be, the minute you say free market, the minute you say, well, people think elites, they think rich people, and they think something's being taken away. But what the Republican Party should be really good at doing is talking about, look at all the things that have changed our lives in the last 20 to 30 years. I mentioned one, Spotify or iTunes. How do people meet each other nowadays, JD? There's studies. There's a great book out right now called The Complacency Class, and it talks about us becoming a matching society. Match.com. That didn't exist 30 years ago. How do people go for trips now? They use Uber. I can tell you that a couple days a week, I have Uber Eats delivered to my office so I can keep working. These are all free market ideas, but when you put it into the context of the user experience, it changes everything. And what the Republican Party has allowed the Democratic Party to dictate the debate on is coverage. You're never going to win a debate with a party that says, we'll cover everybody, no matter what the cost is. That's the Democratic Party's position. So the only way you're going to win that debate is if you go to the real pain point. And what I see, aside from my involvement in politics, but my involvement with Rotella Legal Group and as a general counsel to all these different healthcare businesses across the country, is doctors don't like the way they're practicing medicine anymore. And guess what? Patients don't like the experience that they're having with their doctors. Patients want a Uber experience. The Republican Party needs to, I saw that the president last week brought out the victims of Obamacare. I'd make a suggestion. Let's start bringing out and selling those solutions, those Match.com solutions for healthcare, the Airbnb solutions. JD, they're out there. There are things called telehealth. They're concierge medicine. They're things that people can wrap their brains and minds around and say, you know what? That's going to bring me closer to my doctor. And then let's get the doctors out there talking about how they've hated that they've turned into being essentially data entry professionals for big data and metrics that have to go to Washington, D.C. in order to get paid by the big institutional healthcare payers of Medicare or Medicaid. Let's get doctors and patients talking visibly in the public, using the bully pulpit that this president has more than anyone I've ever seen in my time. Let's have these folks out there talking to the rest of the American people. I think that's what would, if there's anything that's going to tilt this debate, that's what it'll be.
And as you mentioned, the president and the bully pulpit now exponentially larger, in part because of the scorn that the media continues to heap on the 45th president. There is the area of executive power and executive action. And to that point, we can take a look at an article from Reuters. We'll put it on the screen. The headline, Trump studying executive action on health care, Senator Rand Paul says. So Rand Paul and President Trump have been discussing it. If you could, and you offered a great suggestion in terms of communication, in addition to, quote, victims of Obamacare, personalizing and bringing forward the very human embodiment of solutions to Obamacare. But with your knowledge of healthcare law, are there 2 or 3 things that this president could do by executive action, not having to wait on the Senate or the House or an eventual conference of a bill that has been watered down to the point where, yes, it has some good things, but it also keeps in place a system that sadly causes significant harm?
Yeah, absolutely, JD. And I've talked about this before. American folks aren't naive. I really think the folks out there are not naive. There are winners from Obamacare, and they are large health systems, they are large insurers, and they are big pharma. The Democratic Party is not doing this just because of their ideology, that they wanted everybody to be covered, which is what they originally wanted. Remember, the original bill had a public option in it. Those winners, all of those big players win because Obamacare, or if we get closer to a universal payer, those are more paying customers that are predictably paying customers. There's 6 pages in the Affordable Care Act called the Medicare Shared Savings Program. Those 6 pages, more than any part of the Affordable Care Act, and I'm one of the masochists, of maybe 10 of us that actually read the thing. Those 6 pages changed how folks, doctors, and large health systems get paid, from fee-for-service to bundling. So you have a whole bunch of folks, especially the Medicare population, that may be listening right now, that never realized under Obamacare they got Groupon. They got bundled, and they're bundled into these accountable care organizations. That was an idea that they would share risk. The government would share risk with these groups, and if they kept costs down, the doctors' groups and hospitals and large hospitals could keep some of those dollars. Now, there's been some private accountable care organizations that have been set up as well. You've asked a great question. What could the president do? I haven't heard it, but it should be on his radar. I would tell CMS, we're going to immediately not recognize any of these accountable care organizations. We're going to take away all of these shared savings. You want to see doctors and health systems that have bet millions and millions on that model get scared overnight into some serious reform. That's a pain point. That's a pain point that hits doctors, health systems, and providers right in their pocket. Now, I'm not in the business of trying to do that to doctors and health systems, but more than hitting Congress in the pocket, if you get doctors and the actual care providers to be going against Obamacare or the lack of any reform and publicly doing it, JD, in my opinion, that's the way you're going to start seeing real reforms.
You mentioned what happens to hit people in the pocketbook. The president's already talked about taking away the measure passed by the Office of Personnel Management, or enacted at the behest of President Obama, to keep senators and congressmen out of health care. Yet you're not going to keep some of these guys away from the debate. Case in point, Lindsey Graham. Like a moth to a flame, old Lindsey always shows up, perhaps more for media attention than a viable solution. But now he's out there saying, no, let's get out of it entirely and give it back to the states. Here's what he said a couple of nights ago on the Fox News channel. Let's look and listen.
We should be politically horsewhipped if we don't try again. The best idea we haven't even brought up: take all the money under Obamacare and block grant it back to the states. That ends single-payer health care. The government closest to the people is the best government. The health care closest to the people is the best health care.
Yeah, the only caveat, that really sounds great, but there'd have to be a cap, or you would get such a monstrosity of Medicaid. You'd still have California and New York doing unworkable deals and trying to break the bank. But with the minute that remains, could a cap on Medicare and on the block granting to the states theoretically work in terms of what Lindsey Graham had to say there?
In short, JD, no. And I think that Senator Graham may have seen the musical Hamilton too many times. I'm waiting for his next soundbite to be, let's just go out and duel, and the winner gets single payer and the loser gets, free market health care. Every day he seems to come up with another idea. You cap Medicaid, there's going to be winners and losers. It's the nature of a cap. And the losers always end up being, in my opinion, the folks who need it most, the developmentally disabled, the poor elderly, and who will be the winners? The deadbeat dudes you and I always talk about.
Yeah, those
So no
deadbeat
cap.
dudes. We got to get rid of those deadbeat dudes. Brian, I appreciate your time. We'll have you back again. Our time is short. Back with more after this.